Widely available and effective therapies to treat COVID-19 in outpatients are needed. Exogenous interferons, such as Pegylated Interferon Lambda, could stimulate antiviral immunity and treat early SARS-CoV-2 infection. A new trial examined whether early treatment with Pegylated Interferon Lambda could lower the risk of disease progression among symptomatic outpatients with COVID-19. In this Phase 3 randomized controlled trial, 1,949 adults in Brazil and Canada who presented within 7 days after symptom onset, had a positive rapid antigen test for SARS-CoV-2, and had at least one high-risk criterion for COVID-19 progression, were assigned to receive a single subcutaneous injection of Pegylated Interferon Lambda or placebo. Most patients had received at least one dose of COVID-19 vaccine. The primary outcome was a composite of hospitalization or transfer to a tertiary hospital owing to COVID-19 progression, or an emergency department visit due to COVID-19, defined as observation for more than 6 hours, within 28 days after randomization. The risk of a primary outcome event was approximately 50% lower in the Pegylated Interferon Lambda group than in the placebo group, a finding that was consistent in both vaccinated and unvaccinated participants. Secondary outcomes also favored Pegylated Interferon Lambda, including the composite of COVID-19-related hospitalization or death. The incidence of adverse events was similar in the two groups. The authors conclude that among high-risk symptomatic, largely vaccinated outpatients with recently diagnosed COVID-19, the incidence of hospitalization or an emergency department visit was lower among those who received a single dose of Pegylated Interferon Lambda than among those who received placebo. Full trial results are available at NEJM.org.